Hello everyone and welcome to Module 5. This week our focus will be on the topic of endocrinology. And this week we actually have quite a few chapters we're focusing on. We're going to look at chapter 32, and that's all of chapter 32. Chapter 37, pages 837 to 839. Chapter 43, page 1011. Chapter 48, 1145 to 1146, and finally chapter 57, which is 1354 through 1356. So we have a lot of material to cover, so I'm going to go ahead and just jump right in and get us started. So to start off this week, we're going to start talking about chapter 32, which is talking about the endocrinology system. And this is an elaborate network of glands that communicate within the body to secrete hormones for the purpose of maintaining homeostasis. The primary glands in this system are your pituitary gland, pineal gland, thyroid gland, thymus gland, parathyroid glands, pancreas, adrenal glands, and then the ovaries in females and testes in males. So now that we know what the parts of your endocrine system are, we really need to discuss the functions of this system. The vital function of the endocrine system is to produce and regulate hormones. Those are chemical transmitters that regulate different body functions, including those of growth, development, mood, tissue functions, metabolism, and sexual functions for both males and females. Now with this, your nervous system works very closely with the endocrine and exocrine systems to maintain homeostasis. Our bodies are equipped to respond to internal and external stimuli. When the nervous system perceives something as harmful, the body responds by creating a negative feedback loop. This means that the body acts to reverse the direction of change to regain or maintain its homeostasis. Likewise, other actions that our bodies make or take in response to a stimuli produce what we call a positive feedback loop. This is where it will encourage the stimuli to continue or even accelerate, which also helps to maintain your homeostasis. So now the next topic that we're going to talk about in chapter 32 is going to be the different glands of your endocrine system and what they're used for. So we're going to start off by talking about your hypothalamus. This is situated in the center of the brain below the thalamus gland. It is similar to size and shape of that of an almond, and it is the connection between the endocrine and the nervous system. The main function of your hypothalamus is to start and stop the production and release of other hormones throughout your body. The hypothalamus also produces two specific hormones. It produces the antidiuretic hormone, or ADH, which is responsible for increasing your water absorption, and it creates oxytocin, which is a key role or key player in that of pregnancy and childbirth. Then we have your pituitary gland. This is located near the base of the brain in the cilia tachycure, which is a small depression in the sphenoid bone. This gland is considered what we call the master gland, and that is due to the fact that it regulates all other endocrine glands. Next, we have your pineal gland. This is located at the posterior end of your corpus callosum in the brain. It secretes what we call melatonin, and this is released at night, and it helps to regulate the circadian rhythm, which is responsible for helping with the cycle of sleep. Your thyroid gland is responsible for the body's metabolism. It is located anterior to the trachea, just below the thyroid cartilage. It is shaped very similar to that of a butterfly. Your thyroid gland is responsible for secreting three hormones: your thyroxine, or T4, trioxythyrin, which is T3, or calcitonin. Next, we have your parathyroid. There are 4 of this type of gland, and they are located within the posterior surface of your thyroid gland. Each of these small glands is about the size of a grain of rice, or 3 to 5 millimeters in diameter. They secrete your parathyroid hormone, or the PTH. This is responsible for the amount of calcium that is stored in bones and the amount of calcium that is circulating throughout your blood. Next, we have your pancreas, and this is considered both to be an endocrine and exocrine gland. The exocrine function is in the secretion of gastric juices to the small intestine via a duct system. The endocrine function resides within the islets of Langerhans, which is a small cluster of cells within the pancreas that secrete hormones directly into the bloodstream. Then we have your adrenal glands. They are located at the top of each kidney. The triangular gland consists of an outer portion and an inner portion. These portions serve different functions of the hormone production. The outer portion secretes a group of hormones called corticocorods, mineralocords, and androgens. All of these hormones are essential for life. The inner portion synthesizes, secretes, and stores calcitonin, which is then released into the bloodstream when something or someone is experiencing a physical or emotional stress. Ovaries are the primary reproductive organ of the female body. They produce both estrogen and progesterone. These hormones promote growth, development, and maintenance of secondary female sex organs, and are characteristics which include sexual desire, body hair growth, breast development, and the feminine body features. Testes are located in the male scrotum and help to produce the male hormone testosterone. This is essential for normal growth and development of the male sex organs. Placenta is a spongy structure that joins the mother and the fetus, and it provides a blood supply between the two. This is only present during pregnancy and acts as an endocrine gland by producing estrogen, progesterone, and the HCG hormone. And the last 2 we have are your gastrointestinal mucosa, which is the lining of the stomach and small intestine that contains endocrine cells that produce specific hormones by facilitating digestion. Then we have your thymus gland, which is composed of the lymphoid tissue and is located in the mediastinal cavity in front of and above the heart. The thymus is part of the lymphatic system, but also functions as an endocrine gland by releasing 2 hormones, thymosin and thymopoietin. Now, this chapter does also discuss some of the common disorders and diseases of the endocrine system, but I'm going to leave that for you to read on your own. Now we're going to move into chapter 37, which is assisting with and dealing with medical specialties, but we're only going to focus on the piece that talks about endocrinology. Now, endocrinology is the study of the endocrine system, and there are 2 types of glands that we focus on, exocrine and endocrine. Exocrine will secrete hormones into ducts that carry the hormones to various parts of the body, where endocrine will secrete hormones directly into the bloodstream without any ducts. An endocrinologist is a physician who specializes in diagnosing, treating, and managing of diseases with both endocrine and exocrine glands. Now, as a medical assistant, your role will be that of what is very similar to all others. You'll room your patients, you'll obtain vital signs and measurements, you'll review their medical history and complete any questionnaires that the provider needs. You'll perform frequent venipunctures, perform glucose monitoring and education, provide education and support based on treatment, and assist the physician with maintaining accurate medication records. Now, the endocrine system and the providers within that will focus on two groups of diseases, those that are hormone related or related to the thyroid, and diabetes mellitus. Hormones are chemical messengers produced by the endocrine glands and transported to targeted tissues by the bloodstream. The majority of endocrine diseases are the result of an hormonal imbalance. Sorry about that. The under or overproduction of even a small amount of a hormone can have a drastic consequence for the patient. Now, diabetes mellitus is the most common endocrine system disorder that you will encounter. Approximately 17 million people have been diagnosed with diabetes mellitus, and nearly 200,000 die each year from it. It is characterized by hypoglycemia or high blood pressure, which is a result from a lack of insulin or resistance to the effect of insulin. Without insulin to assist in the transportation of glucose to the cells, a patient will experience adverse symptoms like excessive thirst, excessive urination, excessive hunger, rapid weight loss, fatigue, itching, and skin infections, as well as vision problems. If diabetes mellitus remains untreated, life-threatening diseases can occur, such as a stroke, cardiovascular disease, loss of limb as a result of infections or amputations, blindness that's called by retinal damage, kidney damage, or even diabetic comas. Now, Chapter 43 is talking and focusing on medical emergencies as we discuss the endocrine system. We need to discuss how to handle diabetic emergencies. That means handling patients with signs and symptoms of hyperglycemia or hypoglycemia. Both conditions may cause rapid onset of altered levels of consciousness. The greater risk to the patient is someone having hypoglycemia. This is when the blood sugar falls below 70 milligrams per deciliter. This may be a result of a skipped meal, vomiting after taking medications, excessive exercise, or could be from some unknown reason. The patient may appear intoxicated. They can have cold or clammy skin, or have some anxiety, or even be combative. The person experiencing hypoglycemia is in grave danger when their blood sugar drops below 40 milligrams per deciliter. That's when the brain requires glucose to survive. If there is any doubt about whether a patient is having hyper or hypoglycemia, glucose may be administered. This can be a paste that you put into the gum line, a tablet that you have them suck or chew on. They could drink orange juice that has added sugars, or if they become unconscious, you can use IV glucose. Regardless of their state, you always want to keep the patient warm and comfortable. Alright guys, I'm going to stop this video here. I'm going to do a part 2, which will talk about the last two chapters, which are chapter 48 and chapter 57, as well as your homework. So make sure that you watch both videos this week, and I'm going to go ahead and post a second one for you to watch now.